Development, Tuesday, January 31st, 2023. Councilmember Galamba.
Here.
Councilmember Farrelletto.
Here.
Councilmember Rivera.
Present.
Councilmember Scanlon.
Present.
Councilmember Wingo.
Present.
Council President Pridgen.
Here.
Councilmember Bowman.
Present.
Councilmember Nowakowski.
Here.
Quorum is present.
From the top, please.
Item number 1, disposition of real property, 1127 Main Street.
Motion to send without recommendation. Motion is to send without recommendation, seconded by Mr. Scanlon. Thank you.
Item 2, more homeowners are embracing no mow May.
Motion to table. I think we can receive and file this unless we have someone here to speak on it. Mr.
Yeah,
Farrelletto.
if we can table this item for 2 weeks, and someone's going to be here in 2 weeks to speak on this item.
Okay, motion is seconded by Mr. Farrelletto.
Item 3, letter to Water Authority regarding fluoride in water.
This item is open. Okay, this item is open. We are waiting on a letter from the Buffalo Sewer Authority. And before we go into any type of discussion, let's go to Corporation Counsel for a comment as to what Mr. McFoy was recommended today.
Assistant Corporation Counsel Karen Gordon. As it relates to this item, it has been brought to the attention of the city and of the Water Board that we have been named in a pending lawsuit. At the moment, we have not received service on the lawsuit, but as a result of that, it has been advised that we don't go into any great detail since we don't know what's the nature of the lawsuit and we don't want to increase the city's liability. Thank you.
That does not mean that it's not open for comments from the public. I know that we have some people here that wanted to speak on it. It's just that the city has to be exceptionally careful when there's impending legal action over what is said in front of prior to the court action taking place. But we have some people that wanted to speak. I think Ms. Gay and Mr. Pridgen.
Mr. Chair, I know and I appreciate Corporation Counsel advising us. I want to be clear, though, from what I'm told, counsel is mentioned in the suit. And so I would ask Corporation Counsel to go back to the Corporation Counsel to brief this counsel in a session, in a closed session, because Corporation Counsel represents this counsel also. What I don't want, and I want to be clear, is to read in the paper anything that's going on with this situation, because without us having any information, because our constituents are not going to call Corporation Counsel, they're not going to call the court, they're going to call their council member. And so we're learning this information today, and I think you all are just learning it today too. But this is an important issue, and it needs at least, we need to know as the sitting governing body or legislative body, information that we hope to get today on the floor. And I don't know what's going on with mics today, but information. So I know you can't give us that commitment, but I would ask that you would take that back to the Corporation Counsel and schedule, and we can have it, go in open session and then go into executive session. And I would hope that that's done by next Tuesday when we're all back together. Even if it has to happen during the council meeting, we go into executive session. This council needs to be brief, and we need the knowledge. And at this point, we don't have it.
Okay, thank you. We do have, before we go in to my colleagues, we do have a statement that I have asked to have clocked in for the council for next week. It is from Mr. McFoy as the chair. Thank you for the invitation to speak on behalf of Buffalo Water in reference to the Buffalo News article of January 17, 2023. While it was my intention to speak before this honorable body to clarify what has been reported and to answer your questions due to recently filed litigation, at the advice of counsel, I am unable to speak on the matter today. Sincerely, Mr. McFoy. We'll make sure that this gets clocked in for the council meeting. Mr. Rivera.
Thank you very much, Mr. Chair. As a result of the Buffalo News article from the 17th, I had requested Mr. McFoy to come before the Common Council to speak on this matter. To his credit, he has contacted my office, and he had planned to be here today. However, because of the pending litigation, we as council members perhaps have to be very careful because we are party to the litigation at that point. So we're here to listen to the general public, to experts in the field of fluoride. And at the very end of this, we just want to make sure that whatever optimal level of fluoride or supplements that people can take in their homes, that they do so if it's available to them. As far as the pending litigation, we'll have more information once we go into executive session, but certainly we'll be careful as to what we can and can't say here today. But I'm looking forward to listening to experts in the field. I thank those that have made themselves available to come here, explain their knowledge of what people might be experiencing as a lack of fluoride and how we can supplement that, even if it's out there somewhere. So I'm looking forward to further discussions, both with folks that are here and the administration and the water board, to find out what's going to happen going forward.
Thank you, and I apologize to anybody that's listening to this. We're having some issues with our microphones today. Council Member Ferraletto.
Thank you. I certainly understand because of there's the litigation that Mr. McFoy's not here. I did have several questions that I wanted to ask him on the record, which I no longer will be doing that. It's obviously up to everyone on this body, but I would suggest possibly we come up with a list from council members, send it to him. He could answer those questions, and then whether he has to go to the city attorneys first before he responds or what, I think there's some basic answers to questions that we should get responses to, and we should be able to share those with the public because there are many valid questions and concerns that came up. And if this litigation lasts years, I don't think people should wait years to get some basic answers that they probably have the answers to today, and we're likely ready to answer those, but for the lawsuit that was filed in the last day or two.
Okay, thank you. We've been joined by Councilmember Wyatt. Mr. Wingo, you have the floor.
Thank you, Mr. Chair. I essentially was going to say exactly, maybe not those exact words, what Councilmember Ferraletto said. But I do have this question. Are the individuals who are suing here today, are the petitioners here? The petitioners are not here. Okay.
We don't believe so.
All right. My comment was going to be geared toward the fact that now the public will be literally blinded because of this litigation. And again, I agree and I concur with my colleague that now that this litigation is ongoing, it could be years before the community, before my constituents realize what happened and why it happened. So everyone's left to assume because we can't discuss it at this point. So I believe this probably hurt more than it helped with getting answers for our residents. And my comments there, Mr. Chair. Thank you.
Okay, thank you. Mr. Wyatt?
Thank you, Mr. Chair, and I'm sorry I was late to get here regarding this important issue. And I think I said this before, and I don't think I'm saying anything that's something that we can be sued on, is that there should have been full transparency, and it may have been already said. But I have the 2021 annual report, and it talks in here about fluoride, but nowhere in plain vision do you see where it says fluoride is not being included anywhere. I mean, you look at this, it's tiny. You know, I need my readers to read it, but I think the biggest issue for me, because what do we do going forward? I know there's a lawsuit for what happened, but what are we doing going forward? And I know that we've been told that we'll have fluoride added at some point, but again, there's no clear deadline. And I think I said that during one of our committee meetings, that we talk about changing something or fixing something, but never really given a deadline to say, hey, by this date. And I think that's the transparency that we must start having with organizations, especially the Water Authority. I mean, I'm a member of the Water Authority since I became the finance chair, but when this decision happened, I wasn't nowhere to be seen. But I think that going forward, and I said this during one of Water Board meetings, that there has to be more transparency. And I believe that everyone was open to that. Again, the whole issue with Flint, Michigan, and the water problem is something that we never want to experience again, and we want to make sure that we're transparent. I think when Steve Stepniak was last here, people had questions regarding the quality of water, and he could direct them and say, hey, you can get your water tested. You can contact the city. You can get your water tested. But for this one, this was a shocker, and I know that a lot of people are upset. And matter of fact, I just met with some folks that just asked me the question about the water. And I said, I have no idea. We have no clue. We have no idea what the rationale was from it, other than what I've read in the newspaper, which was really alarming. And it's almost like, it seems as though it's kind of the same type of thing, that we make decisions and we don't consult with people who may know more than we do. And that's a shame. We have the School of Dentistry here at UB that I'm certain would have lent their 2 cents if there was an issue with what we've done. But again, I think we have to continue to start moving outside of the silo and get people's opinion and not be afraid of what they tell us, because it really is trying to do what is the best for the public. It's not what's the best for me. I'm glad that my children have fluoride in their toothpaste and they brush their teeth every day. But there are some children who may not have that, and the drinking water is essential for them to have that fluoride treatment. But again, I'm looking forward to having that executive conversation, that we can hear some of the details. I wish someone would have been here to speak to it. I know it's a legal issue, but we shouldn't even be in this position right now had we did the right thing up front and had that dialogue beforehand. But again, we seem to shoot ourselves in the foot every time with things like this, that it should not be an issue, especially when we know nationally that water is a big issue. So I look forward to further conversation. Thank you, Mr. Chair.
Okay, thank you. Mr. Nowakowski?
Thank you, Mr. Chair. I won't be redundant, but I do just want to have one parting statement where I certainly understand that litigation towards the City of Buffalo, and I believe Corporation Counsel, is the Common Council named in this lawsuit as well, or is it just the city in general? The Common Council is also, so as lawmakers, we have to be cognizant that.
Sorry, Assistant Corp Counsel Karen Gordon, the City of Buffalo is named.
The City of Buffalo is, okay. But as lawmakers, I'm assuming we have to move forward with being careful. And this lawsuit, to be honest, was not timely, especially when the Common Council was set up today here to hear from the Sewer Authority and the Water Board and those that are in charge of this. So I agree with Councilmember Farrelletto, who brings up a good point, where there's got to be an avenue where a lawsuit can transpire that could take years, but that we could have basis of some information that is pressing to the public to be able to address some needs and some concerns of our constituents. So I look forward to having that meeting and being able to access that information.
Okay, thank you. If there is anybody to speak, we have the microphone on this side here. You can come down. Please state your name, where you reside for the record, and you will have 3 minutes in which to speak. Thank you.
Good afternoon, respected and honorable council members. My name is Joshua Hutter, and I'm the president of the 8th District Dental Society. We are one of the 13 dental districts of New York State. We include 8 counties of Western New York and represent over 1,000 dentists. Thank you for offering time to discuss this shocking and detrimental discovery, namely that fluoride has been purposely removed from the Buffalo water supply for over 7 years. Worse, there is no proper notification or discussion over this unilateral and cavalier decision. There is zero consultation with any dental experts, either locally or nationally. Among children, tooth decay is by far the most common chronic disease. Multiple, long-term, scientific, verified studies have confirmed that drinking fluoridated water keeps teeth strong and reduces decay in both children and adults. It is critical to the oral health of the community that the Buffalo Water Board return to adding fluoride into the city water as soon as possible. In accordance with the Centers for Disease Control Standards for Safety, the American Dental Association supports community water fluoridation for optimal oral health. Multiple research studies have shown that adding fluoride to drinking water has absolutely no effect on the pipes and infrastructure in which the water is delivered. Whether it was delivered through the old dry system or the new wet system, there is no reason to discontinue adding fluoride to the drinking water. Sadly, the level of fluoride has dropped to more than a 5-fold decrease. Studies from the CDC show that discontinuing additional fluoride to the water for this length of time negatively affects oral health. Shockingly, this occurred with no proper notice, nor consultations with any dental experts and public health organizations. The effects of withholding fluoride pose irreversible effects to the health of Buffalo citizens, especially vulnerable children and the ever-increasing geriatric population. Already, our local dentists are seeing that decay has grown in the city. For some of those affected, fluoride in their drinking water is the only form of prevention that can be afforded to them. The Water Department compared Buffalo to Flint, Michigan. However, this comparison is faulty. Lead was introduced into the Flint water sources due to corrosion from the absence of an additive called orthophosphate. So without the additive, pipes will corrode and release lead. Therefore, adding fluoride to drinking water does not cause any corrosion or add the possibility of lead entering the water system. If this haphazard and ill-informed comparison were true, Grand Rapids, Michigan, which has been fluoridating in water for over 75 years, would have experienced corrosion of lead in their water system from fluoridation. It is also important to mention that even the U.S. Surgeon General, Dr. Murthy, has even stated that water fluoridation is one of the CDC's 10 great public health achievements of the 20th century. This has been a violation of the public trust to allow the citizens of Buffalo to be misled and assume that they are being provided with the health benefits of fluoridated water when they are in fact not. On behalf of the 8th District Dental Society, and most importantly our patients we represent, I respectfully thank you for your time.
Okay, thank you. Oh, Mr. Herb, okay.
Greetings. My name is Pamela Gay. I'm going to ask you a few questions. First, what do all of these communities in the United States and Canada have in common? Wills Point, Texas, population 3,000. State College, Pennsylvania, 75,000. Eldora, Iowa, 2,700 population. Crawford County, Georgia, 2,700. Forks, Washington, 4,000 people. Upper Allen Township, Pennsylvania, 21,000 people. Total of 247 communities in the U.S. and Canada have rejected fluoride in their municipal water system. I have come as a resident of Buffalo to bring awareness to this issue. This happens to be a civil rights issue and an issue of compassion. And I'm a nervous wreck right now, but I'm going to do the best I can. What is fluoride? Where does it come from? That's what I look at. I dig deeper. I'm a retired Buffalo school teacher. People think, oh, that must be natural. Natural to put that in our water. Well, I'm going to, and forgive me for reading things to you, and not being able to just talk off the cuff here. Okay, so the main fluoride chemical called fluorosilicic acid that is added to water is different than most people would think. It's not a naturally occurring compound. It is a corrosive acid captured in the air pollution control devices of the phosphate fertilizer industry. I always knew this, but I had to dig a little deeper to find out that this is a toxic waste. Fluoride is captured in air pollution control devices because fluoride gases are hazardous air pollutants that cause significant environmental harm. This captured fluoride acid is the most contaminated chemical added to public water supplies. In Western Europe, what is the proportion of countries or that area that do not use fluoride? Got to find my answer here. 97% of Western Europe do not drink fluorinated water. There's a book out called The Case Against Fluoride. I'm going to talk about chlorination for a minute. Chlorination is treatment of water. Fluoridation is treatment of people. Chlorine is used to make water safer. It kills bacteria and other vectors that carry disease. Millions of lives have been saved, and we know this. Fluoridation, on the other hand, is never used to make water safe. It simply uses the public water supply to deliver medicine. Once medicine is added to tap water, key controls are lost. It's impossible to control the dose and who gets the medicine. This is forcing medication on people without their informed consent, especially in the case of low-income families and any family that wishes to avoid this medicine. There is a correlation in there and studies that have been done and looked at Harvard, and I'm going to read just a little blurb on that. I am passionate about this. How many studies have been done that have found a correlation between fluoride and lower IQ? 36 studies, for your information. In July of 2012, Harvard University warned that the developing brain is another target for fluoride toxicity. Ladies and gentlemen, we are talking about our community that has many disadvantaged people and poverty level people that are using water to make baby formula. There's no safe limit to ever put fluoride in baby formula. Babies and people with kidney disease, it's very difficult to excrete fluoride from kidneys. And babies are just born and they have so much to get used to. Fluorinated water in their formula is disadvantageous. Going back to that, 12 of the studies the Harvard team reviewed found IQ loss at fluoride levels that are deemed safe in the U.S.
Okay. You've exceeded the 3 minutes. If you could try to wrap up, please.
Okay, I'm going to wrap up with a quote, one quote. I'll pick the one from Andrew Young. I am most deeply concerned for poor families who have babies. If they cannot afford unfluoridated water for their baby's milk formula, do the babies not count? Of course they do. This is an issue of families, civil rights, and compassion. We must find better ways to prevent cavities, such as helping those most at risk for cavities obtain access to the services of a dentist. Thank you very much for your time and attention.
Okay, thank you.
Red is on. Good afternoon. My name is Samuel A. Herbert, and I'm a concerned citizen and a community activist. And I'm an angry individual to find out for the last 7 years, fluoride was removed from our drinking water. 7 years, not 7 days or 7 weeks or 7 months. For 7 years, this council, whoever was elected in their seats for the last 7 years, you lacked leadership. Which one of you on the council have any scientific or science background? That gentleman who spoke, I support him 1,000% of everything he said. Public mistrust from the leadership of the city of Buffalo, from the common council members to Mayor Brown, to every administrative head in the water department. The audacity, you shaft myself and the public. Fluoride has been something that's been put in our water. I'm 73 years young. Since I was in elementary school, it's something that just supposed to be like penicillin when it comes to an infection. Just something that is supposed to be. We go through our daily lives, whatever we do, council member, whatever we do, executive, whatever job we do, we go through our daily lives, turning on the water at the house, our children, making sure they go to the dentist, making sure that there's no cavities, because we know fluoride is in our water. So I'm speaking out for every citizen in this city that feels shaft, that lost respect for the leadership of the decision-making individuals in the city of Buffalo when it comes to protecting our health. Fluoride is a preventive mechanism that was developed in a laboratory, in a petri dish. I'm a former research cancer technician, and I know how important it is to have fluoride in our water. And as I said, I'm angry. And don't blame the parents. They do what we all do naturally, turn the faucet on to give the baby some water, to put it in their infant formula and mix it. Them thinking everything is cool. Then we find out week before last, for 7 years, the public have lost mistrust in the leadership in the city of Buffalo. And I'm calling you all out, because I don't understand how the Common Council don't keep an eye on the health preventive issues that lie in the water department. Heads are supposed to roll. Thank you, Mr. Chairman.
Okay, thank you, sir.
Good afternoon, everyone. My name is Dr. Brendan Dowd. I'm a trustee at the American Dental Association. I'm a past president of the New York State Dental Association, as well as the 8th District Dental Society. I'm also a clinical assistant professor at the University of Buffalo School of Dental Medicine. The local dental community strongly feels the decisions made by the Buffalo Water Authority over the past 7 years concerning the addition of fluoride to the drinking water in Buffalo were short-sighted, lacking in scientific basis, and hurtful to the citizens of Buffalo. The overwhelming scientific evidence for the past 75 years, including randomized clinical trials, systematic reviews, and meta-analysis, verifies the positive effect of fluoridated water at the right percentage, having beneficial effects to the oral health of the community it serves. Studies have shown when there is no fluoride in drinking water, the devastating results from increased cavities in children and adults. The lost time at school and work, the increased costs, the negative effects on overall health all make these decisions that were recently and in the past made totally unwarranted. Our community needs an explanation, and as a citizen of Buffalo, I have a personal interest in this. With our community in Buffalo having legitimate concerns with equity and inclusion, this stands out. What better way than to equitably distribute an effective and safe process to improve not only the oral health, but the overall health that is inclusive of all of its citizens? We have many poor people living in many areas of this city, and they were unduly harmed by this. What were they thinking? It stretches the mind to rationalize their thought process on this over the last 7 years. Adding fluoride to the water has no, and I repeat, no, effect on the pipes that carry water to our citizens. Studies have been shown that multiple times, and we've sent the council some information, some studies that at your purview you can take a look at. There was no need to test this or think about testing this over the past 7.5 years as far as fluoride was concerned. I call on Mayor Brown and his administration to start adding the proper concentration of fluoride to the drinking water of Buffalo today. The people of Buffalo deserve nothing less. Thank you for your time.
Thank you. Mr. Robinson?
Yeah, Arthur Robinson, I'm a community activist. First of all, I'd like to know 7 years ago who made the decision to cut this. Second of all, like the gentleman just stated, people are calling me and asking me, is it the fluoride up to where it should have been 7 years ago? Mr. Chairman, I don't have an answer for that because I don't know if it's been added or not. We need to know these things. You know, people are worried about their kids' teeth and all that. And dental is very important to people. So let's hopefully get this back online where it should be. Thank you.
Okay, thank you. Sir?
Yes, my name is Frank Barnashuk. I'm the Secretary-Treasurer of the New York State Dental Association and Emeritus Clinical Assistant Professor at the University at Buffalo School of Dental Medicine. Mr. Chairman and members of the committee, thank you for allowing me to speak. I wholeheartedly agree with Dr. Hutter's and Dr. Dowd's written and verbal statements to you regarding the effectiveness, cost efficiency, and safety of water fluoridation. It is a great tool for reducing the occurrence of dental cavities in all of Buffalo citizens, including adults, but especially children. My purpose in speaking today is to discuss the role of New York's public health law that covers fluoridation. It is known as Section 1100A. Let's discuss some of the things that it says a city, town, or village must do if it is to discontinue fluoridation in New York. And yes, Buffalo has not temporarily suspended fluoridation. After 7.5 years of not adding fluoride to Buffalo's public water, Buffalo has discontinued fluoridation. 1100A states that before discontinuation of fluoridation, the city must comply with the following. It must issue a notice to the public of its preliminary determination to discontinue fluoridation for comment. This should include the justification for such action, as well as concrete alternatives for fluoridation that is available. Additionally, it must include a summary of consultations with health professionals, as well as the state health department concerning the proposed discontinuance. The nature of these consultations with appropriate professionals and their names shall be identified in a public notice. Additionally, any public comments received or responses to such shall be addressed by the city. Secondly, the city is expected, in writing, to notify the state health department 90 days before such intent to discontinue. The submitted plan must include the expected date of discontinuation as well as available alternatives for fluoridation. When I read the Buffalo News early in the morning 2 weeks ago today, I nearly jumped out of my very comfortable lounge chair. As a dentist who has taught at the UB School of Dental Medicine since 2001, it was the first time I had heard that Buffalo had discontinued fluoridation. Like all dentists in Western New York, I was in the dark regarding the fact that Buffalo citizens, our patients, had not been receiving fluoride in their water for over 7.5 years. I ask you not as a lawyer, which I am not, but as a layperson regarding the law. Have Buffalo's Water Board and the City of Buffalo met the spirit and intent of Public Health Law 1100A? I think we all know the answer. It is absolutely not. Fluoridation was removed in virtual secrecy, and it is time to reinstate fluoridation now. We owe it to the health and welfare of all of our citizens. Thank you.
Thank you. If there's no one else to speak, we will table this item and keep it in front of this committee. And hopefully once the litigation begins, we will be able to get some answers. Mr. Rivera.
Thank you very much, Mr. Chair. And it's important that we understand why we are here today. It's because this council sent a letter to Mr. McFoy asking him 3 questions on behalf of our constituents, our residents, our children. One was, why was the decision made? Second was the dissemination of the information. Was it adequate enough? And then thirdly, the health impact. We're all concerned about that last portion of it, the health impact. What is the optimal level of fluoride in our water, drinking water, to prevent tooth decay? We don't know it because there's nobody here to answer that here today. What should people be concerned about in terms of alternatives and supplements, knowing now that there's no fluoride in the water system? And let me just say for the record, I don't believe there was one council member here that had any information prior to the news article that there was no fluoride in the water system. We found out when that article came out. As a matter of fact, the mayor himself stated in an article in the paper that he wasn't aware. This is the mayor of the city of Buffalo. He wasn't immediately aware that there was no fluoride in the system, and he was quoted in the Buffalo News just recently. This council is taking leadership here. The fact that we are here today listening to professionals on both sides is because we're speaking on behalf, and we are very upset. And I believe when we do have that meeting, I think that things are going to be a little heated because we want to know why. And certainly we are looking forward to that meeting, whether it's in executive session. But we're going to reflect the anger and frustration that we're feeling here today when we have that meeting. On behalf of the residents, thank you.
Okay, thank you.
Motion to table?
Motion to table, seconded by Mr. Bowman. And thank you for those that came down to speak.
Item number 4 concerns denial of purchase of city property 3241 Bailey.
Items open.
This item is open. Mr. Wyatt?
Thank you, Mr. Chair. I'm sending an additional letter to the Director of Real Estate regarding this matter. Again, we were not given a timetable and when this will be resolved. I'm going to be asking for a date and time for this to be resolved with Mr. Kim. This property, this gentleman has been trying to get this property for over 2 years, and I want to see it resolved. I don't want to keep it open-ended that this man keeps wondering when it's going to happen. We should have a timetable, so I'll be sending an additional letter. So if we can table this, I'd appreciate it.
Okay, motion is to table, seconded by Mr. Wyatt.
Item 5, calling for the installation of AED on City Hall floors.
Items open.
This item is open. Mr. Bowman?
Thank you, Mr. Chair. And at a later meeting, we're hoping that we'll have representatives from Public Works and from Human Resources, hopefully next committee meeting. But this was something that was important to me after seeing the DeMar Hamlin situation. I kind of got my wheels turning of what do we have here in City Hall and across the city in all of our municipal buildings. So I'm asking for an inventory of what's in place currently at our assets, and also here in City Hall, I found out that we have one on the first floor, and I believe another on the 11th. I want to make sure that that's adequate to achieve the 3-minute response time. Additionally, I'm asking for CPR and emergency response training to be available for our City of Buffalo employees, so that's something that I think would be important. You kind of see in the media right now, a lot of different places are doing that. Duville just did a training, a lot of people attended it, so I think just from proposing this resolution, I've heard from a lot of people that are interested in knowing, so those are a couple things that are important to me, and so we'll look to have some representatives and that speak on this at our next community development meeting. Thank you.
Okay, thank you. Yeah, I think it's a great idea, and I'm glad that you came up with this, and especially because Mr. Hamlin survived. It wasn't a tragedy, but there's much good that can come out of this. And as the chunkiest member of the council, I want to thank you. Motion to table.
Motion to table.
Seconded by Mr. Scanlon.
Are we off the table? Or
Yes.
Take from the table items 7 and 23.
Motion is to take from the table items 7 and 23, seconded by Mr. Farrelletto.
Item number 7, inquiry into the December 2022 blizzard.
Items open.
This item's open. Mr. Nowakowski.
Thank you, Mr. Chair. Before I speak, we are joined by Citizen Services, and if they can detail their overall synopsis of 3-1's performance and what they were doing during the blizzard. I have a few pointed questions, but I want to hand it over to them first.
Good afternoon. Oswaldo Mestri, Director of Citizen Services for the City of Buffalo. I want to say thank you for inviting me to answer questions and to speak on the Division of Citizen Services and 311 Blizzard's response, I believe you said. And so, again, just wanted to thank all of the council members for giving me the opportunity. Let me first say this. I want to give my gratitude to all of the employees at our office for giving of themselves during this blizzard. It was a challenging time for all of us. These operators and the employees at the Division of Citizen Services were gallant in their efforts in talking to people and citizens all throughout the city. In fact, it was the Common Council and the mayor's investment that we were able to do to have remote operations. We're one of the few 311 call centers that have a remote operation. That was this investment. Without that, we would have not had 311. Operators were able to work from home and with equipment. In fact, myself and Bob had to deliver some battery packs and things when power went out, and they still were up and running. And many of them worked on holidays, and throughout the evening, we took calls, we returned messages, to find out inquiries. We'd made connections with Buffalo Fire, Public Works, trees. There are many times where we were able to make that connection on delivering the most essential services, but more so when power is out, people were looking for a place to call. And it was important. They had trained operators to either just talk to them. I would say that I was one of those individuals who were out with power, but I was coordinating on my cell phone, and how important it is when you do not have power that sometimes your phone is the ideal information to get information and to push that out. And so our office was equipped to make sure that we had information to push information out, also monitoring our Facebook page. So again, I can't say enough for the operators and to Bob, who is our connector with all of our departments and what we were doing in that respect too. So I just wanted to take that opportunity again to say thank you, and to you. We were also, give a shout out, I don't want to do one more than others, but we were in contact with some of your council staff, Councilman White's office, Councilman Golumbek's, all I can say names, but many of you were able to contact us so that we can make those connections. And so I'll pause here and I'll be open to any questions that you may have.
Thank you, Mr. Chair. The first question I have was, when were operators for 311 operating throughout the duration of the storm, meaning in live calls, or was there a break in when operators were taking live calls and just returning voicemail messages?
Okay. So the 311 Operations Center was always up. We continue our operations in terms of taking calls and then also following up with messages that were with people who could not get. Obviously, when you have this type of an event, with the bevy of operators that you have, we have operators that call in a queue, and sometimes they will leave a message. They were continuing to leave a message because they knew we were following back up with them. So I would say from the hours of operation, we were activated that Friday on the 23rd, and that we started taking calls and continued our operation until the 30th of December.
Okay, because I really want to, and this is just to get answers to better equip through one,
Okay,
because moving forward, when especially seniors and especially during a natural disaster and something that to that magnitude, folks just need somewhere to call, and we oftentimes want non-emergency calls to be directed to non-emergency numbers so they don't flood 911 because they're addressing very serious emergency needs. So I think that at times the importance of having a live person on the phone is just critical to keeping people not only safe, but keeping them calm and accessing resources and knowledge, because a lot of folks are calling 311, I know, just to get the latest updates of the storm. And it's important that all those calls were directed to 311 and not 911. I just have another question is, do you feel moving forward, well, it's a two-part. So in my view is when it's a natural emergency, whether and this is, I know this is just in a perfect world, when you're a city employee and there's a natural disaster, you need to be activated and ready to work. It's just, we're public servants. It's a natural response to emergencies. So for Mr. Mestre, I just have two questions. The first is, do you feel that you have enough equipment for 311 to be able to fully operate in remotely in times of emergencies? And did you find that any upgrades were needed after the storm?
Great question, and I would throw that back to you because another strategic investment from this council in this year's budget is an upgrade to our 311, not because of a storm, but because that is the routine of having the way we've been doing things. And so we're in that process. We put an RFP, we're reviewing and looking at best of class that are out there. We have a good system. We're excited about the system that we have, but we're always looking to do constant improvement. Other than, making sure that the operators who are taking the calls are well equipped, not because of their calls, but this is not the job for the faint of heart, right? There's a lot of responsibility and a lot of weight that is put upon them. The mayor and other commissioners have made sure that the mental health of our workers are very important and that they are equipped. And so we've been able to do that, constantly checking on our operators and our call takers. So that's very, very important. So we're always looking at, every time we have an event, we speak to our operators, we speak to our partners. We work very closely with block clubs. We work closely with a network of organizations that we're working with. There's an organization called Anchor that we're working with in terms of other agencies and looking at ways that we can do this. So 311 was one aspect, but we also worked with citizen services afterwards, looking at the data to help people with snow shoveling, working with Councilman Bowman's office and the Bengali community and all of that. So it was important to have a depository of what we were able to do to follow back up. And so the other thing I would say too, the call takers or the people working in citizen services are your neighbors. They know your community. They're very familiar because they've taken these calls. Many of these calls were trees that were down, making sure that we responded to people who had needs of dialysis and or health-related things, but roads that needed to be cleared, very important. And also, what you talked about, this as a protocol. So we put out, in terms of calling 311, you're right, if you had an emergency and it was immediate, that was a 911 call, 311 call, but we also worked and we knew that there was an 858 SNOW number, and that was for a specific thing. So it was always important to know what these numbers are and to push that out so that residents understand who to call and what to call. And so, again, thank you for that question.
Mr. Wyatt.
Thank you, Mr. Chair. First, I want to thank Mr. Mestre and Mr. Kuchinger for their leadership in 311. I had a breakfast last Saturday, and Mr. Kuchinger was taking care of his family member but stayed for the meeting, and I really appreciate the time you spent with the residents. They had a lot of questions, and you were able to answer them. And again, thank you so much for your assistance. We work very closely with your department. I think you and Doris are constantly in contact, but I think that 311 is going to be essential as we move forward, and if we can have an emergency manager. I know the council president has talked a number of times about having a live voice to be able to talk to, and having your folks remote kind of lends itself to that. I know for a number of years we have talked about some extending hours for 311. We haven't got there yet, but I think when we talk about increasing services and areas that we can improve the quality of life, I think 311 is definitely one of those, because people after hours, they can't get you. They gotta wait till the next day. But having that live voice, it's like, you call up different companies today and you get a voicemail. You don't get a live voice. And to me, that's lacking customer service, because real customer service, you can talk to somebody. In some cases, you call the airline today and you don't get a voice. You get something later on. But I think as we move forward, especially as we talk about this response to the blizzard and any other emergency in the future, I think 311 is going to be an essential component to that, because that is an area where you can get a live voice. And so, has there been any more conversation about extending the hours of 311?
Again, always looking at ways that we can improve our services. With the looking at the new system that we will be rendering, and looking at the movement across the country is to do self-service, where people, one, taking the call, but having people go on their device and also onto the computer for those calls that are quality life, the ones that are easy reaches, right? There's some that are a little more involved that you have to speak, but as much as you can have people push to self-service is an important thing. Of course, again, there are going to be opportunities that we can speak. We're constantly looking at not this call volume, the peaks. We're looking at where during the day or even in the afternoon where we have peaks, and so we can deploy staff to that as well. Obviously, that's an investment in terms of what we're looking, but it's something that we're continuing. And I'm not looking, but I'm looking over to Council President Pridgen, because that's something that at the last meeting he wanted us to make sure that we were aware of, and looking at our numbers. And so we're at that point where we're looking at numbers.
Yeah. Well, I'm hopeful, Mr. Mestre, that maybe up for this budget cycle coming up, that we could at least have a pilot to test it out, see if it's a need for the residents, because if it is, then we need to provide it. And especially as we look at how do we operate regarding emergencies, that pilot could really lend itself to us seeing how effective this can be in the state of emergency. So maybe that's something that you can talk about and look at, because I know that that's something that, again, the quality, when we looking at investing money, and it improves their quality of life. You know, people are willing to pay a little bit more when they know they're getting something out of it. They're not willing to pay it if they're not. So again, thank you. Thank you, Mr. Chair.
Thank you.
Mr. Pridgeon.
Thank you, sir, and thank you and your staff for all that you do and that you did through the storm. Just a couple quick questions. My colleague asked about the days that you all were operating with live voice. What were the hours? I think that was probably the heart of the question.
Hours of operation, we were up to, so on specific days, there were days where we were open up to 6. There were days that we were open up to 7 p.m. We were looking at the monitoring of the calls. There's sometimes a trade-off where you can see where calls are kind of diminishing, and so at that point, we also, on holidays, we were activated and we worked that whole, I think that was that Monday.
Yeah, I'm more interested like in the hours.
Oh, in hours.
Because you gave us the day.
Okay, yeah.
But was the latest that 311 was accepting calls at 6?
Yeah, 6 p.m.
So you are right. I'm going to reiterate my call again, and this is why. Because now people can work from home, it would seem to me that during a storm, life-changing storm, that we could have put a supervisor, somebody on to take live calls. I've asked for it. This is what I've asked for over and over and over and over and over. I asked for 311 to be open. Well, many of us, not just me, have asked for 311 to be open later for people who get off of work and then need to call. I understand about the new system. I'm very cautious about it, and I'll tell you why. The majority of people who call my office are elderly. I put my parents in it. I bought my mother a computer 3 years ago that she probably doesn't even know the password. So she's not getting on the computer. My dad calls 311 constantly to come get the vermin that he catches in the backyard. My father is not going to get on the phone and click. Some people may, but I would be cautious because the compliment you just got from Councilmember Wyatt about the live voice and somebody to talk to. I think I'm a little concerned, and as we talk about whether the manager, whatever we're going to do, is there's going to be another tragedy, another storm, another something. And I think that we have to be sensitive during those tragedies to be able to say and have a plan that this line is going to be open all night, and to have our staff ready for that when it needs to be, because they don't even have to come out of their houses. But I can promise you, you've seen it in print, council members received those calls when there was nowhere else to call. And then we had to make the calls and find different, which is okay, I'm not complaining about it. But I think that it is so important to activate an emergency force during an emergency. People, I'll give you an example. Like you said, the 85 whatever number, right now you can't repeat it. You don't even know it. Neither do I. So how do we expect people out there who are without power, couldn't see the TV, to know to call 85 whatever? They won't. So they're going to call 2 numbers, 3. They're going to call 311, and they don't care whether it's you need to call 911. It's like, I'll tell you this, I called 911. I was live, 4 o'clock in the morning, trying to get a rescue for an elderly couple who people wouldn't open the door, live. I on live called 911. I got an operator that wasn't from 911. And I think the second time, I got a recording that, the lines were. So people, including myself, were very frustrated because there was it's like, what do we do? 311, unfortunately, you run your department so well that we need more. And I think the older I get and the more I ask for something that I know is the right, I know it's the right thing, I know it's the right thing. And then when every year, so that we're clear, when we get to budget, I have heard the same exact thing. We're looking into it. Now I'm at the point of saying I don't want to talk about looking. At least if you're not going to be open for when people get off work, that means somebody's got to take their lunch break, call at 12, hope they get an operator, then if they get a call back, they're back at their desk or back doing what they do. If you're not going to be open late, at least there should be a plan and already worked out, because I believe you do have union workers, already work it out with the union. How do we activate people during a storm or tragedy so that people if I'm in a car and I'm calling 911 and I can't get through, and I call 311 and I get a recording and somebody's going to call me back in the morning, it's too late. And we got to be serious in this city and across this country. I mean, tragedies are happening everywhere, and they always have been. But now with global warming, we're seeing a whole different shift in the pattern. And this city that is known for snow has to be ready for their constituents to talk to a person all night long during a blizzard. The technology is there, and I'm done. I got one question. I'll leave it because I think you've heard me loud and clear. And so that way we're not going to be battling that budget because we've said it. And if that's not something that is thought to be important, then shame on us. Is our system in the cloud, or is it in a tower or something?
So our system is cloud-based, and that's where we'll be moving to. I should say this, and maybe I wasn't clear. When I say we were doing callbacks, and thank you for that, we were calling back people that same. If you called, we were calling you back that evening. We were calling you back. If we needed to call you back at 10 o'clock at night, we had staff, because part of this here, having unionized worker, they can work for so long. I had several department heads on the phone. We orientated ourselves and said, we're calling back. And so whoever we can get who left a message, because part of that, when people are calling and they can't get you leaving a message, you're right, I'm not waiting to the next day, because I don't know if there's a tree on somebody's house. I don't know what's going on. And so we were calling people, even I was calling people at my home on my cell phone. We were all calling people to make sure that we took that message, and if we needed to get more information, to input that in this system so they get that. So if I didn't make that very clear, that's not the take away from what you're saying. But
No, I appreciate that, Ms. Mestry. The numbers you're putting together, does it show, will it show even those who call after hours? Because I think that's important to show, are we getting calls at 5 and 6 or whenever there's not a live body?
Yeah, we have the system that allows us to do that.
So
Yes.
when that's submitted, I'd like to see what the numbers are at night, after 5, whenever you're getting calls. I think that's important. Because if people aren't truly calling in at 9 o'clock, we got it. But we got the proof, that we got the data. But if they are calling at 6 and 7 and they're getting they have to leave a message, we need to know that, so that as we make these decisions, as you make them and as we push them, that we have the data to back it up.
And we'll have that too. And so just to hear what you're saying is, there is, during the emergency, where you have a system that is going to be pushed to the brink. Our system was pushed to the brink when we had COVID. I pushed the system when people, for the TOPS incident, people were calling. Our system is pushed to the brink, so we want to be able to make sure that our system is tested and has been tested. Now, to your other question, when it is not, how do we have coverage, and looking for that in the evening too?
Yep.
So I think mission critical, Mayor understands that in terms of our operations. In fact, we have other cities calling us to see how we're doing it, and some of the inquiries that we're getting from other people. So I will definitely follow up with you on that.
Okay. Councilmember Wingo.
I, too, was interested in extended hours. Council President had already articulated that point very adequately. The only other thing I was going to mention was that the staff in our 311 Resolution Center were, in fact, calling constituents back, because we have voicemails in our office complaining that they got a call back late in the evening. But that does not discount the fact that we do need to extend our hours to ensure that folks, when they are in certain crises, that they have access to our resolution center. So should this come up in the budget this year, I'm looking forward to discussing it and ensuring that we have what we need to extend the hours in 311 to work in tandem with this new system that they are proposed to have. Thank you, Mr. Chair.
Okay, thank you. Mr. Nowakowski, table?
Motion to table?
Motion to table, seconded by Mr. Nowakowski. Thank you, guys.
Item 23, promotion of Ethiopia, peace and democracy.
Motion to receive and file.
Motion to receive and file, seconded by Mr. Pridgen. And motion to adjourn.